$1 million a year. That's how much Banking and Insurance Commissioner Arda Logan estimates it'll cost the government of Guam to implement certain provisions of the Patient Affordability Care Act.
It is a tax. As a tax, we mirror the code, so it applies to Guam. That is our opinion.
Local health insurance companies had requested that Logan issue an opinion on whether the individual mandate applies to Guam based on the Supreme Court of the United States ruling. Based on Logan's opinion, this means that employers and individuals would be required to get health insurance beginning in 2014. The government must also decide if it wants to participate in a health insurance exchange or opt out. Logan says participating would cost the government at least $75 million a year, but even with a subsidy that will be divided among the insular areas, Guam would only end up with $3.75 million a year.
This is very similar to the Compact Impact, requiring the islands to spend what we don't have, and the EIC, just basing ourselves on what it's going to cost versus what the exchange can do for the government. What it's going to cost the government, it's not. I can't see how we're going to implement something when we don't have the funding source to make that happen.
Public Health, meanwhile, is looking at the impacts of the SCOTUS decision as it relates to Medicaid. The government would be required to provide a 45% match and agree to expand the Medicaid program in order to receive $268.3 million in funding.
So now, those clients who are under MIP, who are single and couple, can qualify under the Medicaid program as long as they meet the income and the citizenship criteria of the program.
While there are pros to the Medicaid expansion, Medicaid Program Administrator Tess Archangel says they expect the number of clients to increase to 50,000 in just 2 years.
We would need workforce. We need more staff in order to implement PACA, in order to meet the requirements of ACA.
Guam Community Health Center's Administrator Linda DeNorsi says that many people just can't be accommodated right now.
Our plan is to increase access to all these patients that are uninsured, and we want to get more of the insured people to become our health center patients. By 2014, we anticipate about 3,000 more new medical users. But to prepare for these additional users, the centers, we have to increase our revenues. We have to get additional funding to recruit all our doctors to provide all the types of care that we have, including preventive care services.